Is India ready for smart diagnostics? The answer is yes. However, our readiness for smart diagnostics depends upon the demand and the supply. The demand from practitioners of diagnostics, including self-use. Supply, our ability to produce next-gen components. If this demand and supply could be linked, then India would be ready for smart diagnostics, because ability to champion components to produce smart diagnostics, and ability to consume and self-test, use these smart diagnostics for self-test is the true engine for demand. This is a brilliant platform to discuss such questions. ASSOCHAM has done a great job. Our best wishes to ASSOCHAM so that we can continue to discuss, debate, develop, and democratize diagnostics. Thank you.
It's a pleasure to be here at this smart diagnostic event of ASSOCHAM, and I think one of the important part is, are we ready for it? I think yes, I think to some extent, but I think a lot of needs to be done. We need to build up an infrastructure, and most importantly, the trust, because we have many technologies which are being used in the besides healthcare. These technologies already been existing in use, but healthcare, very important part to develop a trust. So technology is ready. I think the healthcare industry is ready. The customer is, our patients who are supposed to be using it, they need to be now aware and make sure that it is used in the right way, right manner. I think we need to have some regulations, we need to have some awareness, and we need to have a right kind of analytics to make sure that whatever the technology we are doing, or smart the adoption we are doing, it's for the beneficial to these people. But I think it's important. Without that, we can't get away, because for tier 2 and tier 3 cities, especially remote areas, this is going to do a lot of wonder. That's it. I'm looking forward. Thank you so much.
So I am happy to be part of ASSOCHAM organized India Diagnostics Summit. And the question which was asked to me is whether India is ready as a country to play a role in what is called as smart diagnostics. Now, when we talk about smart diagnostic, it's right from procurement to report delivery, right from collection of sample, whether, or if in case of imaging, whether it is imaging interpretations. Now, most of it is already happened in radiology. If you see, MRI or CT scan reporting can be done distantly through digital imaging at radiologist's home or any working place. In pathology, it hasn't happened to the same degree, excepting in case of histopathology and authorization of normal reports by artificial intelligence-based software. So we have some way to go, but we are moving in the right direction. And going forward, I see a larger role for smart diagnostics in India. I wish ASSOCHAM and the Diagnostic Summit the very best today in Delhi at Lalit Hotel. Thank you so much.
I do think India is ready for smart diagnostics. India technologically, with its computer engineers, the data scientists, the young startups, has always been at the forefront of technology. And also, it may surprise a few people to know that healthcare IT and healthcare technology startups are second only to the IT ecosystem in terms of numbers of the startups. And hence, with in-house, make in India kind of technologies, and with education systems which are, and skilling systems which are developing, which are actually changing, we are more than ready to become a diagnostics industry with smart systems, artificial intelligence, IoT, being able to transmit automatically reports onto cell phones, onto computers, and also being able to share data and derive benefit out of the humongous data that we have in our country, make us more than ready for taking on the world.
So India specifically is very, very much ready for a smart diagnostics because this is a country with so much of a population. There is a different sort of an audience. We have within India so many countries. North is different, South is different, every West is different. For even a genetic data today, we are dependent upon the West. And that is why India specifically needs its own genetic data, its own data to study of every kind of a medical sort of a disease. At the same time, it needs, so the stress levels are different, food levels are different, city-wise things are different. So specifically now, because we are the highest users of mobile, we are on internet, I think we are completely dying for really having a smart diagnostics near us. So you see a lot of people wearing watches, rings, bracelets, everything doing sort of a wearable analysis and figuring out their own steps, getting more popular devices in and using wearable and sensors, which probably is an origination and a need for a smart diagnostics in India. So I'm a big believer that India definitely is fully ready for a smart diagnostics in all sense. Thank you.
Is India ready for smart diagnostics? Definitely India is ready for smart diagnostics for a multiple set of reasons. The way Indian diagnostics has grown, today it's supposed to be a $15 billion market and growing at 14-15% of CAGR, which is about 6% of total healthcare. It has been possible because of what I call I square C, innovation, collaboration and commitment. Tremendous innovation has happened. It has been a metamorphosis, disruptive metamorphosis over the last 30-40 years. The way diagnostics business models have changed, the way technology has enabled Indian diagnostic segment to address the needs of the patient, and the way diagnostics has grown up as a very important segment in Indian healthcare. Indian healthcare very much is enabled by the expertise of India in IT. So I think diagnostics itself is now looking forward to the technology of future, AI, artificial intelligence, machine learning. All these will be enablers along with great leadership. For leadership, I've got one important point that I want to mention, 3 bullets. One is leadership in diagnostics have to continue adapting to the new technologies and the new business models. They have to embrace it. They have to move forward without feeling threatened by the by new technology coming in, and there'll be therefore a lot of reskilling, there'll be a lot of de-skilling needs, and whole lot of new training needs, adaptability of talents that they hire, and how they will produce the best of diagnostics for the patient. It's important to note that you can have the best of musical instruments, that is technology, for example, but unless you have good musicians, you will not produce good music. And therefore, skill set, very important point in moving forward for making India a smart diagnostics capital. Lastly, for all this to happen, infrastructure is very important, where government and private sector have to collaboratively work together so that the infrastructure of IT and in other areas can support the smart diagnostic needs. Thank you very much.
Let me introduce myself. Myself, Dr. Gautam. I'm handling Horiba India here. And the question is that whether it is India is ready for the smart diagnostic. I think yes. A lot of things is happening in the diagnostic field, and I think today we are discussing under the ASSOCHAM the same thing here about the smart diagnostic, about machine learning, about artificial intelligence. So many things is happening, and I think this is the way of smart diagnostic to reach our villages and the township. Otherwise, diagnostics, or especially the in vitro diagnostics, was more or less related to the labs and the cities and other things. So we will not be able to reach the common man, which is in the villages and township. Suppose we become a digital pathology or digital things or machine learning or artificial intelligence, I think we can include the diagnostics to our common man, So I think India is ready. So many things. We have a lot of companies, a lot of software companies which are working together with the diagnostic professionals. I think yes, it's still a long way to go, but I think we are ready for that. Thank you.
So the question is India ready for smart diagnostics? So yes, definitely India is ready for smart diagnostics, whether it is the patient or the healthcare providers or the government or the regulators. But it depends on what kind of smartness that we are looking for. Smart in the sense of more accurate and precise diagnostic, yes, that's something that every patient wants, every healthcare provider wants. Uh, and do we have the capabilities? Yes, we have the capabilities both in terms of hardware as well as the software solutions that will enable our diagnostic labs as well as hospital providers to give you smart diagnostics, smart results in a shortest span of time. Uh, well, government is also very keen that we promote our smart solutions, our smart diagnostics into India. So I look all forward to that. Thank you very much and wish you all the best for this evening.
Yes, very interesting question that whether the India is ready for smart diagnostics. Yes, we are ready for smart diagnostics. If you look at how the things have progressed over the last many years, with the launch of the Ayushman Bharat Digital Health Mission, you see that how identity and the embedment of that identity, that ID, into electronic health record, that would be a game changer. But you see that how the electronic health records which are there, if the diagnostics are also inbuilt into that, so that you see that what kind of potential which is having. If you look at all the programs and the policies which are now shaping up, they are trying to use this electronic health records for their policy decisions or for informing the policy level progress and other things. Besides that, now if you look at the way the public sector is functioning, so we are trying to gather the information through blue chip. That means the device and diagnostic, they will be having a blue chip enabled thing. And the information is directly sent from that device to the records. That means we have gone to the testing. Further, if you look at the ways the apps are being developed, so it's very true that we are now moving towards a smart way of organizing it. And this is going to handle and contribute for the clinical decision support system. And the way things are progressing, I think we are moving in the right direction. Thank you.
We are going through some exciting times in India, and there is a lot of digital transformation happening. There is a lot of smart and intelligent IVD diagnostics which are coming up, and this transformation is really leading to a good patient safety agenda and a patient outcomes. So we are seeing clinical pathways being adopted. We are seeing clinical participations happening. We are seeing a very point of care testing device which are there for non-communicable diseases and as well as for infectious diseases. And all of this is making rapid diagnostics easily available for good clinical decision making. Smart diagnostics, an intelligent way of working, is the future. And India being ready for all the startups, and too many entrepreneurs are working in the field of diagnostics, both in lab medicine as well as for imaging technology. We are seeing some very, very great times, great adoption of artificial intelligence, machine and deep learning. All these algorithms are directly leading to good patient safety and good outcomes. The adoption with the clinical team and the hospital management is very, very good. It is really nice to see that all the ecosystems are getting built by public sector, the government participation with Atal Tinkering Lab and smart startups being encouraged. I think in the future, in the times to come, we are going to see lots of good technology, lots of innovative work which is happening, lot of smart diagnostics, lot of early adoption, lot of patient clinical decision, fast decision making, lot of good patient safety and outcomes being presented. and let's work together with the government, let's work together with the industry, let's work together with other private stakeholders to make this as a safer and a very healthy ecosystem.
Yeah, thanks, SOCAM, for having me here. And I would like to say, I think India is glowing across the globe, and definitely the theme of this conference of smart diagnostics. I think India, it is very relevant because we have a huge population and huge disease burden. So smart diagnostics can really play a game changer in it, and it can really address one of the pillar of our healthcare delivery, which is accessibility. People can access more of centers and more of patient can be catered through AI and smart diagnostics put together. So this will definitely help us in long run in delivering the healthcare goals of India. And all the companies mostly are working towards it. We are into imaging, and we are definitely working towards more of smart diagnostics through imaging tools. So thank you so much. Look forward to a greater conference.
Good afternoon, and I'm happy to be part of this ASSOCHAM conference on smart diagnostics. And whether India is ready for the smart diagnostics, the short answer is yes, India is ready for the smart diagnostics. There are a lot of advancement into automation, there are a lot of advancement in integration of diagnostics, and with the machine learning, artificial intelligence, Internet of Things, and the initiative of government, Digital India, digital health, India is ready for the smart diagnostics with the launch of AVA and several other initiatives. So let's look for the smart diagnostics in coming 3 to 5 years. Thank you.
My name is Gautam Bhattacharya. I'm the CEO of Life Sciences Sector Skill Development Council. If we look at India presently, I think we are at a pivotal point wherein one hand we have to develop smart diagnostics and we are absolutely ready for it. On the other hand, we also have to reach diagnostics to every nook and corner, to tier 2, tier 3 cities with basic diagnostics. And I'm sure India is fully geared and fully prepared to take these mandates. There's a lot of government support in both the ends, from penetration of diagnostics into our regular household, into the tier 2 and tier 3, and also coming up with the best in technology diagnostics which will change the world. There are multiple diseases which are yet to be diagnosed through a primary diagnosis, and there is where India's might will come in front and will prove ourselves successfully originating these products. Looking forward to a lot of innovative ways forward and a lot of technological integration into the diagnostic space. I'm very hopeful India will do very well in diagnostic space. Thank you.
So I would say yes, smart diagnostics have a major role to play in India. We can see that India, 70% of the Indian population lives in the rural area, while the 80% of healthcare infrastructure is exist in urban areas. So here the smart diagnostic can play a better role to bridge the gap between urban and rural area in terms of the healthcare infrastructure and providing the technologies making them accessible to the rural population. The second point, I would say, we have more than 500 million users of smartphones in India, and internet has already paved its way throughout the rural and urban areas. So that's a big achievement, we would say, in terms of making the point of care diagnostics making available to the rural population and bridge the gap. So I would say yes, smart diagnostic can play a major role to bridge this gap and making the healthcare affordable and accessible. And wish you all the best for the conference. Thank you so much.
So, living in today's day and age, what is extremely important is to understand the power of prevention. When you're looking at prevention, screening plays a very important role in not just trying to find out if you are already healthy, but to also ensure that you're continuously healthy. And I think diagnostic industry is playing a very important role. Clubbing it with technology can make it better, which is where you have these wearable devices, remote monitoring, and the technology development when it comes to screening and helping, getting the help of a technician to get the data enough for a trained technician to take a call on what the results are going to be is the development that is going to bridge the gap that we are having in India, where we are having a large population to serve, population that is spread across geographies where we do not have the skilled manpower available. So that's the difference. I think that smart diagnostics can make a difference to a country like India.
I'm Pritesh Sethi. I'm an associate professor at the Department of Computational Biology at IIIT Delhi, and I'm delighted to be a part of the ASSOCHAM Conference on Diagnostics. I think we are at a pivotal moment in the history of India where we are looking at a healthcare transformation, and digital is the way to go. We are completely ready for smart diagnostics because of the amount of data that we have and the amount of analytics capabilities that we have in India. We just need better frameworks to harmonize these data sets, ensure that these data are inclusive and equitable in their nature and can benefit everybody from the ground up, from all tiers of the society. AI has a huge role to play in this because we do not have experts trained at all levels, and access to healthcare will be enabled through diagnostics that can be largely driven through the use of AI technologies in healthcare. So I'm very positive about the readiness of India about AI in healthcare. Thank you.
Hi, I'm Dr. Mohammad Adil, Managing Director of Bangalore Bioinnovation Center. Thank you, ASSOCHAM, for the support and invite for the event. Smart diagnostics and in vitro diagnostics is a market which is becoming rampant in India. So we from Bangalore Bioinnovation Center supports the startups as well as the companies in the TRL level in creating an impact towards the in vitro diagnostics towards Make in India policy. With the policies created such as Healthcare Mission, Ayushman Bharat and all these schemes, so various Sugam systems, various automations are also coming into the picture of smart Indian diagnostics market. So the diagnostics market is kind of not regulated for more than 70% in India. Regulating the market and supporting the startups in regulations and impacting the local market from the tier 2 and tier 3 city will create a bigger impact for India. So today we celebrate the in vitro diagnostic by navigating the bio ecosystems culturing. Thanks everyone.
I think when we think of smart diagnostics, there are a few parts. One is the technology and the second is the adoption. And in both these cases, if you look at where India is today, I think we leapfrogged the world by a few generations, where our clinicians and the healthcare sector is already looking forward to more advanced diagnostics. And we already have a fantastic technological ecosystem in India, which is delivering this and more to not only for India, for the rest of the world. So I think we are very much there for realizing the potential of smart diagnostics in India. I think India is definitely ready for smart diagnostics. What remains to be seen is how the healthcare and the technology and the regulatory ecosystem come together to increase the pace of the deployment of these technologies and then the adoption of these technologies.
Yes, India is ready for smart diagnostics. India is the most populous country in the world, 1.5 billion population. If you need to reach out to them, take care of their health, then definitely we need to have smart diagnostics, wherein the regulator, the hospitals, and all the stakeholders of this healthcare system work together, and it can be really worked out. I see this coming very soon in a very big way. Smart diagnostics or smart healthcare is the future. Thank you.
India is not just ready. I think India needs smart diagnostics very clearly. We have about 130 to 140,000 pathology labs, total about 150,000 labs in India. And the market is extremely fragmented. Today, Indians only do about 2 tests per year, which is abysmally low when you compare to a lot of international markets. US, for example, sits at 20, but a lot of other developing and developed countries are there around 10. We need to bring together technology for testing, for sample movement, for evaluation, for analysis, for reporting, a lot of digital technologies for booking orders, bringing the tests and the services closer to patients. A lot of remote diagnostics, point of care testing, smart labs, AI, analytics, and more than that, testing for wellness and not just illness. Having said that, we need to do a lot of work There is a lot of innovation, there's a lot of deployment of technology that players need to do. And I'm confident that with the promising growth and profitability that this sector enables for all the organizations, everyone in the ecosystem and all the stakeholders will come together, invest in technology and create new services to make diagnostics more affordable, more quality and accessible to everyone. Basically from moving from disparity to parity. Thank you.
Hi, good morning. Myself Chirag Joshi, CEO of Beacon Group. Yeah, India is ready for the smart diagnostics. Now, if you take as a smart diagnostic point of care testing and point of care testing at lab levels and hospitals play a major role in smart diagnostics. So a lot of applications are coming for diagnostics of some diseases which play a major role in India for smart diagnostics. IVD is the growing market and it will be growing around 16% CAGR for next 5 years. Thank you very much.
Hi friends, as you are asked that India is ready for the smart diagnostics. So it's a very good question and it's a current point of the life also, because in diagnostics we cover the in vitro diagnostics, imaging, under the imaging sonography and the radiology is there. So that India is the fifth largest growing company, fifth largest economy in the world, and people per capita income is also increasing, awareness is also increasing, new technologies coming day by day, big multinational companies coming with a new product, new technology in India. As far as the people lifestyle is growing, their per capita income is also growing, so they are coming with the new awareness. So as well as the patient is also afford the good prices, good diagnostic tests, where the new hospitals coming, new hospital chain is also coming day by day, even the tier 2, tier 3 cities. So it's a very good thing that India is ready for the smart diagnostics. Thank you.